private healthcare come into Halifax?
Dude, Hannah was browsing Facebook, saw this ad. She was like, private healthcare. And I went, what? And she looked into it, and it's essentially like Maple, but in person. So you pay a monthly subscription fee, and you actually get to go in and see this, either a doctor or a nurse practitioner, which a nurse practitioner is almost a doctor. Like they do a lot of school as well. And they can do everything from like headaches, colds, sinus issues, prescription refills, minor ailments, and like refer you to specialists and things like that. So it's wildly helpful. The owner, I guess you'd call it, the man who's starting this, found himself without a family doctor after a quadruple bypass surgery. His family doctor retired, so then he was able to join his wife's primary practice. That doctor then retired within like 4 months, and they were not hiring a replacement. So they were both without a family doctor after he just went through quadruple bypass surgery. So he was like, that's what inspired him to start this company.
I wonder how that journey started for him in terms of like how you start kind of rolling that out. I'm guessing he doesn't have much of a background in healthcare.
Well, I think he's a nurse practitioner now. Like I think he is now certified, because I think that going down prompted him to become a healthcare provider.
Oh, is that what happened?
And now he's starting his own business, I think. But if not, he is for sure the one who owns it and is at least hiring these people.
Right.
So he's either maybe the health provider or he's just a business person. I think it's a wildly helpful service.
Right. What are they called? Bluenose Health.
Bluenose Health. See, the issue is there's another company called Bluenose Physiotherapy, and that's what comes up right now when you Google it.
Bluenose Health primary care clinic by appointment only.
Access to the healthcare you deserve when you need it most.
Yeah, they're for real. This is their press release. You said access to timely, convenient primary healthcare is making its way to Nova Scotians next week. Locally owned and nurse practitioner-led Bluenose Health Primary Care Clinic will open its doors on Yonge Street in Halifax on February 27th. And it's everything you said, subscription-based, private, and nurse practitioner-led.
Yeah.
Interesting.
It's honestly really valuable. And one other thing, I mean, this is valuable for two reasons. It's in our community, and it's community-led. Like there's doctors from our community, which I think is important, or NPs from our community. But for anyone with a business who needs cell phone service, and this is going completely, it'll all tie back in.
Okay.
We recently switched our cell phone service for my company over to TELUS for Hannah and I. If you open a business account with TELUS, you get access to TELUS Health for free, which is Maple. It's literally this app, dude. It's insane. I'll show you here. It's called TELUS Virtual Care. You can open it up just like Maple, and you can start a consultation with an NP for free, no cost, just by paying your phone bill.
As a TELUS customer.
As a TELUS business mobility customer with 2 lines. So if you're a couple and you have a sole proprietorship or a small business or a corporation, most people need a cell phone, you can get free doctor access just by paying your phone bill. So tip for the homies who want to switch their phone plan to TELUS, to tie that back into healthcare. There's now, there appears to be tons of options to at least talk to someone who can help. Like an NP can do most things a doctor can. So that's pretty valuable.
Totally. I know Reg Manzer is not happy. We're stoked.
We agree to disagree on that. Yeah. And that's the beauty of life.
Let's see. Get some private health care up in here, baby.
Listen, at this point, I'll take what I can get to see a doctor. It doesn't have to be perfect right now, because what has right now is not perfect either. So I'm okay with somewhere in the middle.
Yeah, it's nice to see a version open up, because I know we had a private healthcare practice that opened up a couple years back and it closed within a year. So I'm curious how this one will go.
I mean, I feel like now more than ever we need it.
Yep.
So
See how it goes.